Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Hello everyone.
Hello,
How are you today?
I'm fine.
I hope you are enjoying your day. Okay, now I want to introduce myself. Okay, my name is Iswatun Hasana. You can call me Iswa. My name is P20620220057. I'm from class 2B nursing. I come from Indramayu. I would like to say thank you for coming to my presentation. Okay, I will presentation a journal. A title is Perceived Ability to Practice in Disaster Management Among Public Health Nurses in Aceh, Indonesia. Ardia Putra, MNS, Pongcenpet Pisetian, PhD, RIN, Homapak Manewat, PhD, RIN. Next. Introduction. Based on media reports and further investigation about Aceh during the period between 2006 and 2008, the province was hit 540 times by natural disasters. Ariono, 2009. In Italy, natural disaster events are scattered throughout the many districts and municipalities in Aceh province, but there is no specific pattern relating disaster type to district location. However, based on post-observation, earthquakes, floods, hurricanes, landslides, and aberrations are most often Aryono Putro 2007. Based on the evidence of frequent disaster in Indonesia, the need for the nation, and particularly Aceh province, to develop a feasible disaster management strategy or program in order to reduce the impact from disaster is clearly apparent. Next. Disaster management can be defined as the arrangement made to minimize the potential adverse effect of a disaster. Manitoba Health 2000, which aims to create a safe environment and continue necessary healthcare service for victims throughout the disasters event. Kuresi and Debbie 2007, to develop a plan for natural disaster management. It needs the support of many kinds of professionals. Savage and Cook, 2009, including nursing professional before math, during math, and after math. Stanley, 2005. Furthermore, some disaster affect people's health and the public healthcare system. PHNS have a major role. They must manage and provide assistance during all disaster phases. Points and Toolbox 2008. Thus, training PHNS for involvement in all these phases is recommended as part of comprehensive disaster management strategy. Polivka et al. 2008, Regards and Lawhorn 2007. To overcome this situation, disaster management guidelines are actually needed for PHNS so that they can improve their own knowledge and skills related to emergency and disaster preparedness. Fang et al. 2008, ANCMCA 2003. In order to manage disaster well, First and Zhang 2009. Next, methods. The stratified proportionate random sampling method was employed to recruit the sample from 27 PHCs in 11 districts and municipalities. Nurses were proportionately and purposefully selected if they met following criteria. The first, a government a contract employee. The second, educational background, at least diploma in nursing. The third, having at least 1 year work experience in community. The fourth, and able to communicate in Indonesia language. Next, the public health nurses perceived ability to practice regarding disaster management questionnaire PH&PP-DMQ consists on 13 items. It was constructed for use in the study based on the exciting disaster management guidelines and Jennings standard framework. Each item was rated by using a 5-point Likert scale with the following values: 0, not able to practice this at all; 1, hardly able to practice this; 2, uncertain ability to practice this; 3, able to practice this when following given instruction; and 4, able to practice this automatically. Next. Discussion. In this study, the PHNS perceived ability to practice regarding disaster management was found to be at a moderate level. The highest level of the PHNS perceived ability to practice was in the recovery phase, followed by the response and preparedness phases. This finding is worthy of high attention from the health service authorities. It indicates the organization may not be prepared to respond properly in case of disaster. Large numbers of healthcare providers are not necessarily needed, but the right level of training are needed for exciting providers. PNEMA 2007. In other words, training the result in high level of ability to practice is the most important aspect. Next, subjects in this study also perceived their abilities to be in the quiet to address additional potential hazards and disasters around their working areas. As noted from the Lowman score per item for 16.7% and together with 2.43, this poses certain question regarding the PHNS ability to recognize the sign of impending disaster. Previously, the right identification of disaster skill has been highlighted as necessary of community study. Reisman and Howard 2008. A study conducted by the Felix et al. 2008 also noted the insufficient knowledge among nurses will lead to their inadequate performance in managing bioterrorism risks. As Indonesia is a country that is prone to frequent natural disasters, her 2010, the skill is very important for people in Aceh, in particular healthcare providers who are most likely to have to deal with some form of catastrophic event. Identifying the risk of hazard and disaster is therefore an important step in order to develop strategies to diminish the impact of disaster occurrences. Manitoba Health 2000. Next, finally, when faced with unpredicted situations such as emergencies and disaster events, nurses must possess the essential scientific and technical skill to provide adequate physical and emotional support to the victim. Sturgeon 2008. Make immediate and effective decisions and protect facilities and resources. Hustle 2006. Because the lack of knowledge among nurses regarding preparedness and their disaster plan will lead to inadequate performance and healthcare providers in caring for disaster victims. Therefore, PHNs need to expand their disaster management knowledge in order to diminish such unsafe unexpected problem. Redmond et al. 2007. Next. Result, overall, the PHNS perceived ability to practice regarding disaster management in Aceh was at a moderate level, M together with 74.57%, SD together with 13.27. The highest main score was for the recovery pace, 78%, and the lowest main score was in the preparedness pace, 66.15%. Next, conclusion. The result of this study found the PHNS perceived ability to practice regarding disaster management was at a moderate level. The highest PHNS perceived ability to practice was in the recovery phase, followed by response phase and preparedness phase. Some factors from PHNS might contribute to the finding in this study, include the subject working area, working experience in assisting disaster victim, nursing education, and attending to training and education that related to disaster. Thank you. Any question?
No.
Thank you for attention. I will close my presentation. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.